Hi. On our last discussion, we delved into management of acne. And today, it's my pleasure to introduce to you one of the very important dermatologists in this country. Her name is Dr. Gacheri. She charges everything she fashions with the breath of her own spirit. And I'm so happy to host her today. Welcome, Daktari, on our session. Today, we are going to discuss the issues about skincare routine, management of acne, myths and misconceptions, causes of acne. So you don't want to miss this discussion. So welcome, Daktari, to this wonderful forum. Kindly introduce yourself.
Dr. Gacheri Kadiri. I'm a dermatologist in Meru County, and I'm also an aesthetic practitioner. That's like cosmetic dermatology as well, apart from just clinical dermatology.
So today I just want to really be very narrow and just delve in acne. Daktari, what do you understand by the term acne? Can you kindly digest acne for us?
If we are to understand what acne is, we need to understand our skin. And generally, we know that our skin has structures. So it's just not a sheet of thing. It has things in it. That's why you can sweat. You can be oily because it's something that is producing oil on your skin or things like that. And we have hair. We have hair like on the rest actually of the skin, maybe apart from palms and soles. So on our, especially around the face, on the upper chest, maybe upper arms, as well as the upper back, we do have a concentration of glands. We call them sebaceous glands. That was biology in high school. So sebaceous glands are glands or a structure that produces oil, because the skin needs oil as well. And that's why sometimes I like giving this example. You know, when you squeeze, we used to do that a lot when we were younger, and you squeeze and you see white things coming out. That is mostly the oil that is kind of concentrated, and there's some, you know, it has concentrated and has become hard. So that is actually oil. Now the tushimo, because we are speaking to Kenyans, you need to understand the tushimos where your oil come from. There's also a hair that is coming through that, and that shimo, when it goes deeper, it leads to this gland. So it's an opening of this gland that will lead hair, oil onto your skin. These cells of these layers of skin are retained into the kashimo, and when it's retained there, it blocks the oil also from coming out. That will make the gland sort of swell, it's blocked. And we have bacteria on our skin and other things on the skin. So the bacteria that is on the skin also concentrates there, and it becomes like food for the bacteria, that blockage. So there's inflammation. Inflammation is what happens when your body, for example, when you talk about the acne, it's trying to get off that thing because it's a foreign body. So inajaribu kuimaliza. So it causes a lot of inflammation. So it gets bigger because there are so many cells there, and the cells of inflammation also causes pus. Maira na Kiswahili inaitwaje?
Usaha.
Exactly. So forms because of that inflammation, and now that is what we call acne. So they can be many. The blockage can be so kidogo, we just call them like open, closed comedons, or if the bacterial inflammation is a lot, then you have pustules, the white acne, we can call it that. And sometimes it's too bad that you have an abscess, boils, almost boils, and so on and so forth. That's why acne is classified from like mild, moderate, severe, but it's a continuum.
Oh, thank you so much. That was well elaborate. Now, Daktari, I have a concern. Most of the guys come to the clinic and they keep on asking, I don't know what I ate, I don't know what I did, what really triggered that. So probably can you tell us some of the triggers or causes of these acne?
Majority of acne is during puberty. This is because hormones are setting in, and it doesn't really mean during puberty that hormones have a problem. It's only that your body is changing, your skin is actually sensitive. Now these glands are sensitive a little bit more to the normal hormones you have. It doesn't mean your hormones are imbalanced. And then now it drives that until you get acne. And then now you can also get acne when you're an adult, what we call acne tada or later onset acne, because also hormones tend to change around that time. And at that 35, 40, 45, that acne is likely more driven also by hormones than anything else, but it doesn't also mean that hormones are imbalance or something like that. So when you see someone young who has acne and or even very mild acne, and we realize their parents, either father or mother had acne, so we know there's a genetic influence, and we get a little bit more aggressive in managing that acne than those that will take time and maybe some routine, because then it means there's a genetic factor, and if there's genetic factor, that acne will actually really develop, and we don't want someone getting scars and black marks. So there is a genetic factor. The other side of the acne can be because you actually have a problem. Number one, it could be drugs. There are actually drugs, especially some drugs used in psychiatry, some drugs maybe in epilepsy, can actually cause acne. And then there are drugs that we also misuse, especially steroids. So you can get a steroid-induced acne, including just the steroids we apply on the face. After some time, you start getting acne. Sometimes you can get acne from cosmetics, hair products. So the acne we get from hair products and all that, we call it pomade acne, and it tends to just concentrate mostly on the forehead and the sides. Now there's also a condition in women that they can get what we call ovarian cystic syndrome or cystic disease. This has issues with hormones, and now that is what needs to be treated. So that's not normal hormone influence for acne. And it's quite aggressive. The acne caused by ovarian cystic syndrome, sometimes we get to know because we'll ask questions. As clinicians, we'll ask you about your menses, about pains during your menses, and there are things that will be a little off. And yes, so for those, when you treat the ovarian or you manage the ovarian cystic syndrome, the acne improves. When you remove all these drugs you're taking and all that, acne will improve or even clears. But now the other acne, the one we are calling normal acne driven by several things, will not really clear or heal, but we manage. So don't talk of cure, we talk of management of acne. But yeah, generally those are the causes. But there are things now that make acne worse. So things that make acne worse is not cleansing your skin. And cleansing just means washing. There's no big deal like you need a specific cleanser, special cleanser. Not really. It just means washing your face. So we tell everyone suffering from acne, they need to wash their face twice a day, morning and evening. And mostly in the evening, if you're able to, you need to double cleanse. All it means is you wash, you rinse, you wash again, you rinse. That's double cleansing. There is no scrubbing. When you scrub, you make the inflammation worse. And I keep telling people this, when people have acne, they really want to be aggressive. That makes acne worse. They want to scrub, steam, do all these things. That will make it worse. The opposite is also true. When you're calm, you're mild on your face, it calms the acne. So even if you're double cleansing, you don't scrub, just wash enough. Even if it's your hands, the circular motions, rinse, wash again, rinse. That will calm your skin if you're not aggressive. If you're always on phone, for example, be wiping your phone or use a speaker. Your pillowcase also matters. You need to keep changing your pillowcase, not the same dirty area all through. What else? And of course now diet. Okay, so just milk. Let's say milk and things made with milk, so that everyone understands. It will drive your acne. And then sugars, high refined sugars, things with a lot of sugar will also worsen your acne. And so the sugars, let me repeat these, are usually pro-inflammatories. Anything with a lot of sugar, lots of junk and all that will make acne worse because it's supporting the inflammation that is happening. So we advise people, if you have acne, you take foods that are anti-inflammatories, and those are usually colored foods. That makes things easy. So colored foods are fruits of different colors, vegetables of different colors, as well as, these other things like you talk of garlic, ginger, the things you add, hohos, the things you add in your food. These also help to make acne less inflamed, and that supports the management of acne.
Majority of people who tend to have acne are usually people who have oily skin.
Yeah.
Do we have a chances or people who have dry skin also developing acne?
Yeah.
And how do we go about that?
Yeah, so there are people actually with even combined skin, maybe dry areas.
Yeah, exactly.
Yeah, and actually there are people who have acne and their skin is not oily. So remember, acne is being driven by different things, not one thing. So you could, maybe the glands they're not big, they're not producing a lot of oil, but there's still some blockage that is happening. You're still shedding. You also have a bacteria that tends to be the bacteria that is supporting acne more. Yes, you can have acne. You don't need to have an oily skin for you to have acne, but those with oily skin are more prone to getting acne. And maybe just to something I might have missed on what makes acne worse, and I can't afford to miss this, which is like part of what causes acne. Whatever is making it worse, it's also part of that, is popping. You know, we said being aggressive, using the physical scrubbers and all that, but people tend to pop acne. Remember, when you squeeze that skin, it causes more inflammation, affects the tissues around there. That's why if someone is really popping, after they heal, they'll kind of get depressions, utotushimo, and that's what we don't want. So that's why we keep telling you people, don't pop your acne. You'll say it's painful, it looks bad. No, let the drug do its work, just don't pop. If you're just washing and not scrubbing and it comes out that is totally fine, there's no inflammation because you're not really irritating the skin. The last thing is sun exposure. So when the skin is inflamed and it's exposed to the sun, it will tend to protect itself, and it will protect itself by producing more melanin. That's why when you go to bask, we turn dark, and where it's covered is not dark. So because the skin is protecting itself, so it's good to do sun, really good sun protection. If you have any sort of inflammation, actually, even if you've reacted to something, just avoid sun exposure. You can do sunscreens, you can do wide brim sun hat, and generally just avoid the sun.
Amazing. That was well elaborate, and I'm so happy that at least you delved into that. There was the other day I actually saw a video online, and it was really irritating and traumatizing, seeing a patient who have a lot of acne. Actually, the acne was so big, and then of course now this patient was doing all sorts of skin care, including things that were really would leave the skin with a lot of permanent scars. Now, I suppose, Daktari, I want to just quickly take you to our management so that you manage this patient for us. Let's assume there's a teenager that is in high school and she has acne. And then, of course, I also have a man who is a gentleman that is around 30 years. And I have a lady around 45 years of age. So the three of them pops into your dermatology consult and they all have acne. Are you going to manage the same, or do we have a different way of approach?
So most of dermatology issues are not managed the same, and usually my best example that I tell my clients is it's not like malaria, because malaria you might likely give the same medication, don't even give you a review. Remember, this is a journey. Any acne treatment is a journey, and every acne patient is different from the other one. For example, the age matters, the gender does matter, the career matters. Career matters in terms of, yes, what you do. Like I have a model, maybe to add, I'll come back to your three people. If I have a model and I have a farmer, farming is very important. I don't mean in terms of the distance or wherever you want, don't assume that. But the point is, or even a housewife or someone in the office, an IT person who doesn't even see people, and a model or an artist, these two people can't be managed the same way. So there's something we call class, or an older person. Now I come to your case, and a teenage, they can't be managed the same. So first, there's something we call, there's the staging of acne. Then there's something called quality of life. So quality of life is how much is this acne, either mild or severe, how much is it affecting me? Or either career-wise, age-wise, whatever it is. So we need to come up with quality of life. So a teenager has acne and they're breaking down in the clinic. So if this was mild acne, I'll likely, because of the quality of life, get it from mild acne due to quality of life to severe acne. That is what I want people to understand. Then there is this man you talked about who actually has another problem, and then I tell them that they actually have acne because they don't even notice they have acne, and then they're like, so you can do something about this. Okay, so that is someone, even if it was moderate, fine, I might treat it as moderate, but that is very mild because the quality of life is intact, likely for this gentleman. It's tailor-made. So we'll treat according to the classification, we'll treat according to the quality of life. So those are two different things, but also there are different types of acne as well. We said there's a class, but also there's a pattern. So we said, like, if it's hair things and cosmetics, likely to be worse here. There's also a pattern that it's fungal acne. Okay, so it could be pure fungal acne, and this is totally different, and that's the type of acne that might actually clear. And yeah, usually when we see it's fungal acne, we likely will be happier. That will really go down. And also it could be acne that is due to pure hormone issues and not normal hormone issues, and those are the acne that tend to concentrate. We call it either the beard area or the jawline, and this is the type of acne more common in older women. And the reason I brought this up is because when we're treating, let's say older, you said how many years old? 45-year-old woman. There are drugs I might put them on that I know they have. The hormones is not really an issue, but I might put them on anti-androgen hormones, for example, because you know the estrogen is going down and something like that. And these are not drugs you want to put a man on, because a man needs their androgens, you know, something like that. And really it's not a drug that I want to put a very young person on. Or even that young person we realize it's ovarian issues or actually hormonal imbalance, and we put them on pills, and we are not going to put a boy teenage on pills. So be very careful, and the reason I'm saying that is because of copy pasting. Huyu alitumia hii, hata mimi natumia hii. It could have been yake ni bacteria, yako ni fungal, you're just making it worse. And also, because we're talking about treatment, please allow me to talk about isotretinoin, or we'll come to that. Okay. I can talk about it.
Yes, can you?
So, if someone is in reproductive age, or someone wanting to get pregnant, or someone who is young and is saying I likely will have a wedding, that's not a patient I'll put on something like isotretinoin at all. It doesn't matter how bad the acne is. I'll try to figure out other things to do. Reproductive age and it's a man, I'll feel comfortable to put this, because the acne is bad, I'll feel comfortable putting this man on isotretinoin. So do their blood works and see lipids, blah blah blah, they're okay. And then the warning is, do not give your blood, do not donate blood. I'm just shouting that because I know we miss that a lot. We feel comfortable it's a man, and we put them on isotretinoin because we know they're not going to get a child, so their child will not be malformed. But then we forget that these men do donate blood, and when they donate blood, it's likely going to a pregnant woman. And then what happens? The pregnant woman gets a malformed baby, and they're going to say it's God's will, but it's actually my cause or any other healthcare worker or those getting drugs over the counter. So for isotretinoin, I will always preach like this: do not buy over the counter, do not give isotretinoin over the counter, and don't give a reproductive age person isotretinoin, or just don't give isotretinoin. Let the people who understand isotretinoin, in this case mostly dermatologists, do it, or you know, anyone dealing with skin and is a clinician, let them do the work of isotretinoin, because we also need blood works. And we monitor. We don't give you an isotretinoin for 3 months, and you know, we have to monitor your blood and see how your body is breaking this down. Otherwise, you end up with side effects. Yeah.
At least I'm sure our viewers online will really benefit from this, and I'm so happy at least you have shed more light on that, and especially on the issue of isotretinoin. Most of the time, especially in this country, you find that people tend to get them over the counter, which is really wrong, because most when you get it over the counter now without a doctor's prescription, you have a lot of other issues, including also people mixing. I've actually seen them mixing also the isotretinoin together with other things like the cyclines, the tetracyclines, which actually even has more adverse effect, and of course now it's not safe to use them in combination. So Daktari, I would just like to go ahead and ask you a very simple question, and this is now a skincare routine. So probably a patient came to you, they had acne, now you have managed, they're really doing well, and they're asking you, what is my skincare routine? And I've actually seen also what is happening online. Right now we have a lot of things like they're saying skin icing, the 10 steps skincare routine, and all those things. What's your take on these, and how do you advise on simple skincare regime for someone who is starting a skincare? And is it okay? So maybe you can delve in this.
Okay, so I think I'll start with this so that people are not confused. Even for us as skin specialists or clinicians dealing with skin, have different ways of approaching things, and I'm clarifying this so that you don't feel like your other dermatologist is wrong or anything like that. There are people who are generally minimalists. That's where I belong. And even for my own self, like I wouldn't want to do a million things. So of course, then I'll likely drive my patients towards that. And then there are very good dermatologists who are really good with these routines, even for themselves, okay? And they're very keen and with all that. Remember, it's not whatever routine you're given, as long as it's by a qualified person, it's not wrong, but we tend to have our kuna vile tu, it's just like, when you're watching movies and you're all movie addicts, there are those movies you like, others, something like that. I want to clarify that so that it doesn't confuse anyone. So what I'm sharing is me being a minimalist, because I am a minimalist. So I don't like, it's tiring, and sometimes I feel like people would also do mistake, and it's, even for pills, like I'm a minimalist. Even when it comes to taking pills, I'll really work hard to get the pill burden very low. So I'm just clarifying that. So for skin routine, remember, you just need to have your skin clean. You need to cleanse your skin, and you have to moisturize your skin, and this goes for both women and men, girls and boys, everybody across. So, and it's the whole skin, not only your face. So you need wash your skin, moisturize your skin, wear a wide brim, sun hat. Remember, sunscreen sometimes are expensive. I come from Meru. Going to tell a farmer who doesn't have any problem, you have to use sunscreen, then that becomes a problem. And these are the issues actually I have because of the social media. Sometimes we forget to look at the patient, and we just tell people, you must use sunscreen, you must do this. We are very careful because you're going to burden these people. So you can tell them, use a full sleeve, wear that sun hat, kitu inaanguka ili ukiteremsha usichomeke huko nyuma. So that is generally it. So if I'm managing acne, so what we do is, because we're talking about acne, so if I'm telling you to use a cleanser, of course I'll look at how you look, what you have as well. So there are those people I'll actually tell to use sunlight. Now I'm being very practical. As long as you wash morning, you wash twice in the evening. There are those people I'll tell, just get a cleanser with salicylic acid. It will be likely an added advantage because we know salicylic acid is an exfoliator. Remember, we want to get those dead cells out of even the pores. So it's an added, it doesn't mean the other one will not improve, but you have an added advantage because you can afford. And then how do you moisturize? So there's someone I'll tell, it's okay, use Vaseline, it is enough. And I need to make this clear, Vaseline is not comedogenic. Can I call them molecules? They're so big to be absorbed. To make any issue, but the catch is you need to be cleansing your skin, morning, double cleansing the evening. If you're doing some ointment like Vaseline and they're not washing, yes, that will be a problem, because now you're adding into, you remember the skin that you shed, it's not falling off, this is Vaseline, it's coating. So by the end of the day, as long as you remove that first thing and you cleanse the second time, you're good to go. But now if the whole night there's the Vaseline and the cells that you shed are still there, and at night is when the skin wants to rejuvenate, then that's a problem. You can wash it off and now put a fresh layer of Vaseline and you'll be fine. Okay, but then there's that person who I will tell, okay, use this serum because you can afford. If it's a serum with retinoid, it's okay. You know, the retinol serum you can use 3 times a week, and that has some added advantage, and it's fine. And then in the morning we'll tell you, and then you moisturize. So in the morning we'll tell you can use vitamin C serum, where it's an antioxidant. It also helps with the black marks as well as retinol serum at night. It's an antioxidant. Remember, it also protects against UV. It doesn't remove them, but it protects from them. It helps the sunscreen, in short. And that will also kind of reduce the pigmentation that you're getting. If you can't afford, in the morning, use your Vaseline. Wash very well, use your Vaseline, avoid sun exposure. So this is, and then now moisturize. Of course, if you're doing serum, you do some moisturizer. Or you don't really need to do the moisturizer if your sunscreen is actually moisturizing. As I told you, if you have time, do moisturizer, then do your sunscreen. That's totally fine. There are those who want to do niacinamide. Niacinamide is good if you have, acne. Actually, it helps with the oiliness and all that. So there are those even at night who use 2 serums. You do niacinamide, niacinamide can go with anything. Or those who just do only niacinamide if their skin is a bit sensitive and can't handle maybe retinol serum. So I just mentioned those 3 serums are good for people with acne. However you want to use them, that's fine. But if you cannot afford, it's also totally okay. Sunscreen, they're different. There are the premium ones and there are those that are okay. So the premium ones, if you have acne, you can go for those written oil control sunscreen. They are a bit lighter, some are matted, and that's fine because likely you have an oily skin. Remember, none should tell you it's a must. You have to use them. If you can't afford, that's fine. Use the sunscreen that you can afford. If you can't afford the sunscreen, find other ways of doing sun protection. Put on your, everyone can afford a sun hat, unless issues sometimes comes with career and all that. But sometimes I've had to write even letters to let employers maybe let someone use sun hats, like people with SLE, those diseases that actually sun is an actual problem. So that's it. That's the routine that I usually take my patients through.
That's really interesting, and I like the way you have put it, because now most of the time people always talk about skincare routine, and if they miss that, they feel like, I'm actually in a big problem. Now, the last thing that I want us to discuss today, and of course I will be crucified if I don't ask this question, is about the skin gut axis. And I actually saw it on your on your vlog the other day when you posted about that. And there's this lady that asked me the other day, I have a sweet tooth, I like some cheese here and there, some Nutella here and there, some chocolate, and I normally get acne breakouts here.
Remember, it's the largest organ. Whatever you eat matters on your skin. So if you have issues or not, so when you have issues like acne, will tell you reduce milk and yogurt and all that. Whatever goes into your system actually shows on your skin. And also remember, aging as well. Whatever you take does influence your aging, extrinsic, both intrinsic, aging from within. There are things you take, they will mess up your hormones and all that, and it will mess up your internal organs. But also extrinsic, whatever is happening huku nje. For example, sugars sort of mess up with cells. Na ngozi inakunjana. Actually, it drives aging, to make it simple. You know what we said, tunataka kupaka vitamin C, tunataka kumeza supplements ya vitamin C na umeacha fruits. Nataki kukula, oranges, the one I was talking about, dragon and all that.
Exactly. You
leave the most natural thing that is so easy for your body to deal with, and then you go, can I say synthetic? These supplements. Sometimes sometimes you don't need these supplements, you just need your diet, okay? So it's vitamin C, those are anti-aging things actually. So go for these fruits and vegetables. Those are vitamins. So these, they have all sorts of vitamins, and that's what we need. You don't need a multivitamin most of the time. We'll give you a multivitamin because you have a deficiency, okay? Not kunywa multivitamin because kunywa collagen nini. Collagen, peptides, proteins, you know, just have a balanced diet, take different sources of proteins, give you everything that you need. So you don't need to keep swallowing the multivitamins and all that unless you actually have a deficiency. If you lack these things, it will show on your skin. If you take the wrong things, it will show on your skin. Now, if you have a disease, then now that even becomes more, more important, because there are those things you will take and they'll make your skin condition worse, and that's why we're talking about acne. But there are several other. If you're smoking and you have something like SLE, lupus for example, smoking will definitely worsen your lupus. But smoking contributes to skin aging actually, not only issues with lung cancer. So smoking will mess your skin cells and the skin will age. If you're smoking and you have most of skin diseases actually, even the normals and tunajua kina psoriasis, kina nini, even wounds, vidonda, if you have vidonda or you've done surgery and you're smoking, that will make your healing harder, okay? Because this is skin and skin just doesn't like anything to do with smoking and the byproducts of smoking and things like that. The worry is when it comes to children, you know, wanajikuna afu, the first thing they are told by anybody, even kwa chama, kwa neighbor, anywhere, is that stop proteins. It's very wrong. Usually, yes, if you have, let's say, shida na mayai, utajikuna. That's why I said stop copy pasting, okay? Utajikuna. So kama mtoto wangu alijikuna na tukajua ni mayai, nikipata wako anajikuna na kwambia wacha mayai, wacha nini. It's very wrong. Most of this watu mnaambia wachaneni na protein, it has nothing to do with proteins, and you're actually causing malnutrition in children by telling them to stop proteins. I just needed to mention that to feel satisfied. So yeah.
Thank you so much. Thank you so much for this wonderful session. It has been a well elaborate, and I'm sure we have learned a lot from this today. And I'm looking forward to hosting you more. This is Dr. Gacheri, all the way from Meru Ice Dam. And of course, I'm going to tag her page here so that now you guys follow her. One last word for our online viewers.
Be very careful. Anyone here means they are online, so you're watching so many things, and it's crazy. It's just crazy what is outside there. Listen, but verify. Please listen, verify, and stop just buying things from over the counter. And even if it's not drugs, we are talking of skin products. What we've realized is that the counterfeits outside there is very crazy. Sometimes I'll tell you, go use this product, and I'll tell you even the name and the brand. Where you're buying it matters, and sometimes people who are selling to you also don't know that they're counterfeits. It has become a menace. It's unfortunate. We are like helpless, if I can say it. We are just helpless. Anything you hear, verify anything you buy, and ask questions. And when you go to maybe skin clinics and you're seeing all these skin, even if it's not skin clinic, anyone that is treating you, even over the counter, if you're going over the counter, you must ask what they are treating. You must ask what you are being given. Usiseme tu nilipewa tube iko na cream ya white. I mean, you know, what is that? Ama ilikuwa na, no, you need to know what you're using, and if you can't cram, just take pictures. And when now you go maybe to see another clinician, tell them this is what I use, because sometimes what you're using is the problem, and then we might mismanage you because we just really don't know what happened. So it's good, keep track, know what you're doing, know what you're using.
Thank you so much.
Yeah.